We'll take a minute and look at some of the drivers that are kicking the pins out from under the way we have done healthcare all this time. Let's take a look at these drivers of this. A big one is the cost trend. I'm going to show you a graph here. The right side of the cost trend is totally familiar, right? Of course, U.S. healthcare costs twice as much as anybody else in percentage of GDP, any way you want to measure it, right? What's interesting there is the left side. We didn't used to cost twice as much as anybody else. We're always expensive. But something happened, you probably can't quite read the year, when all of a sudden we broke loose from the pack. You notice that? The year was 1982, 83 in there. Can anyone tell me what happened in 1982, 83? DRGs. We put in the first serious effort to control costs. Does this make sense? If you understand systems, it makes perfect sense. What did DRGs control? They controlled the units, the cost of the units. What were they trying to control? The cost of the system. Different thing. If you run, I don't know, Best Buy, say, and you're selling TVs, and you know the market conditions have driven down the margin you can get on a flat screen TV, what do? Well, first of all, you have a sale. You try to shove them out the door, right? Come on, right on down here. We got these flat screen TVs of $3.80. You know, it's ridiculous prices. But that doesn't actually make you much money. What's the other thing you do? You, sir. Chris? Tim. You don't look like somebody who just needs a flat screen TV. I can tell, you know, just talking to you, that you could use a real surround sound theater, home theater type thing, 5-channel, this 58-inch screen will awe all of your neighbors when they come over to watch the Super Bowl and leave popcorn all over the place, and only cost you $5,478.38. Upsell. Now, has healthcare done something like that over the last 30 years? Now, I'm not saying that everything that healthcare does is useless, but yes, sold more items of greater complexity at higher prices, moved stuff out the door. We use more stuff and we use more complex stuff than any other country. That is why we're up there. And it is based on the fee-for-service system that we're in. Let me show you some graphs from the International Federation of Health Plans. So they're comparing actual prices paid by health plans in different countries. And the other countries are comparing the US to are countries where you would not feel uncomfortable if you had to be in their healthcare system for some reason. You know, places like France and Germany and Chile and Australia and stuff. And I'm going to show you a whole bunch of them. But they all look like this, where the United States is off on the right there, and it's like way higher than everybody else. Here's, you know, diagnostics, CT scans, MRIs, different kinds of procedures, appendectomies, bypass surgery, C-section, ordinary, normal delivery, births, hip replacement. They all look the same. Knee replacement, devices. If you get into pharmaceuticals, the same kind of pattern. Lipitor, Nasonex, Nexium, Vitarin, a doctor visit. Now let's slow down here and take a little closer look at one of these. This is a hospital patient day. I didn't pick this because it was weird. I picked it because it was just like all the others. But look, there's some breakdown of the lines there. The 12,500 figure at the top is the 95th percentile. In other words, there are 5% of the hospitals in this country charge more per day, just for a hospital day in the bed, than $12,500. Well, that's kind of stunning. But what's even more interesting is the lower figure. 4287 is the median, but the 1514 is the 25th percentile. 25% of the hospitals in this country charge less than $1,500 per day, and they're not bankrupt. This pattern, and you notice that $1,500 is about equal with the highest of the other countries. This pattern persists in every single one of those, where there is a clustering You'd expect kind of a bell curve around some sort of neat middle and then not too much on either side. That would be a normal market. No, no, no. There's a clustering around the 25th percentile, and then there's these huge outliers way up there that push the median price way up. Now, does this mean that we're looking at places in Podunk versus places in like Boston and Atlanta and such? Well, no. Actually, some of them are in the same market. This is what it costs you to get an ankle MRI in the Washington, D.C. area. Suppose you twisted your ankle or something, you want to have it looked at. Well, you could get one. Now, these are actual prices paid. This is not ChargeMaster prices. You could go in for $400. And by the way, to make it onto this chart, this is from an organization called Castlight, you have to be in the upper quadrants of quality. So this is not fly-by-night places. These are perfectly good places to get it done. $400, $654, $730, $450. Or you could go a couple of miles to the northwest and pay almost $1,900, or a few miles to the southwest and pay almost $2,200. What kind of market is that? I'll tell you what kind of market it is. It's a soft market. That market, nobody's going to be paying $2,200 for something they could get for $400 if they're paying even a slice of it out of their own pocket. Right? I mean, why would you if you knew it was there? What we're seeing is the remnants of an opaque market in which the entity paying for it was not the same as the entity that had concern about the price, and the person actually choosing it didn't have the information or the incentive, right? That is changing. So we see this future here in which you've got increasingly, and this is especially true of new people coming into healthcare under the ACA. You're having these increasingly smart consumers that are very price concerned because they're paying a percentage out of their own pocket, and because they increasingly have the information, and at the same time these savvy employers that are driving down the prices. Those guys up there at the 12,500 foot level, the 95th percentile people, they're doing that for a reason. Even though in their very same markets, people are making a living and keeping their institutions alive at the 25th percentile. So what are we going to see happen? We're going to see that collapse. In a relatively few years, that is going to represent a normal market with the prices in healthcare clustered around the 25th percentile of what they are now.